Keep your student home if they are experiencing any of these symptoms: fever, chills, difficulty breathing or shortness of breath, loss of taste or smell, new or undiagnosed cough, vomiting, diarrhea, new or undiagnosed rash. Let's talk about how to visually screen your student in the morning before sending them to school. Visual screening involves looking for symptoms that can be seen or observed. An individual who is ill may exhibit the following symptoms: behavior change, unusual skin color, new or significant cough, respiratory symptoms, shortness of breath, chills, vomiting and diarrhea. Let's discuss each of these symptoms in more detail. Young students may have difficulty describing how they feel. A change in behavior, such as irritability or fussiness, could indicate that they do not feel well. Lethargy and fatigue are often used to describe drowsiness, tiredness, low energy, or sluggishness. These are common symptoms of illness, and often the first symptoms you may notice in your student. They tend to slow down, fall asleep easily, and generally seem less energetic than usual. Keep in mind, however, that some students do not get enough sleep and may also appear sluggish in the morning. Flushing is defined as sudden reddening of the face or neck. A fever can cause the face to flush or appear red. Exercise, excitement or embarrassment can also cause the face to become flushed. If your student races with a friend to the front door and arrives flushed and out of breath, but otherwise happy and energetic, then your student is probably not sick. But if you notice your student has a flushed face, and also appears lethargic and fatigued like we discussed in the last slide, then you will want to do further screening to determine if they should stay home from school. If you observe a change in skin color different from your student's normal coloration, then you will want to do further screening to determine if your student is well enough to go to school. There are many reasons your student may develop a cough, and it can be difficult to determine what is causing it. Students with asthma or other chronic respiratory conditions may experience frequent coughing as part of their baseline symptoms. Sometimes the cough can be caused by physical activity, cold air, smoke, and illness. Coughs can sound dry or wet or be accompanied by wheezing. A new cough, or a cough that is getting worse, could be a sign that your student is getting sick. If your student has a cough, you should keep them home from school. Shortness of breath or difficulty breathing are signs that your student may be ill. Shortness of breath is that feeling that you are out of breath, like you can't catch your breath or that it is hard work to inhale fully. If your student is experiencing this, you may notice them with their mouth open trying to take in air. You may notice them using their neck muscles or shoulders to try to take in deeper breaths. It is normal to be short of breath after exercise or even if a person is anxious. Shortness of breath should go away soon after your student stops exercising. If your student is experiencing shortness of breath, keep them home from school and contact their healthcare provider. Chills or shivering are often associated with a fever. Your student may complain about feeling cold. You may notice that they are wearing extra layers of clothing or blankets when the weather is warm. If you observe your student with chills, take their temperature to see if they have a fever. Keep your student at home if they are experiencing chills. Vomiting is the forceful emptying or throwing up of what is in the stomach. It is usually an excludable illness symptom, meaning your student needs to stay at home. Occasionally there is an explanation for the vomiting, such as motion sickness from the bus ride. Diarrhea means 3 or more watery or very loose stools. But generally speaking, vomiting and diarrhea are symptoms that require your student to stay home until symptoms resolve and they are told they can return. Your student may tell you they can't smell or taste. They may report that their food tastes rotten or has a weird or chemical smell. Allergies and common colds can impact a person's sense of smell and taste but are often accompanied by other visual symptoms such as runny nose and red itchy eyes. If you suspect your student can't smell or taste, then keep your student home from school and contact their healthcare provider. In the morning, your student may volunteer other information about illness symptoms they are experiencing, such as nausea, stomachache, headache, muscle pain, sore throat, general unwell feeling. These symptoms by themselves don't require that your student stay home from school, but if they interfere with your student participating in class as they normally would, then it's best to keep them home and let them rest. In addition to looking for symptoms of illness in your student, you should consider these 3 questions. Has your student been in close contact with someone with COVID-19? Is your student or anyone in your house sick and being tested for COVID-19? Has your student tested positive for COVID-19? If your student is experiencing any of the symptoms we've discussed, or if they answered yes to the previous slide about COVID-19 exposure, then your student should not go to school. If your student is not going to school, please call your school and let them know. A nurse may need to get more information. Call 911 if you observe anyone with trouble breathing, new confusion or inability to awaken, blue or grayish lips or face, or complaints of persistent pain or pressure in their chest. Thank you for watching. Please contact your school nurse or health assistant if you have any questions.